10 deadly warning signs of type 2 diabetes you should not ignore. Please support this channel by hitting the subscribe button below. Introduction. Take a moment right now and ask yourself, have you been more thirsty lately? Getting up at night to use the bathroom more often? Do you notice cuts that take forever to heal? These aren't random annoyances. They might be your body's desperate attempt to tell you something's wrong. I'm about to walk you through 10 critical warning signs that your body's blood sugar regulation system is failing. Many people dismiss these signals until it's too late. Don't be one of them. By the end of this video, you'll know exactly what to watch for. 1. Frequent urination. The overflow alert. Your kidneys usually filter about 120-50 quarts of blood daily, carefully reabsorbing all glucose before urine leaves your body. But this system breaks down when blood sugar stays above 180 milligrams per deciliters. The kidneys can't reabsorb all that excess sugar, so they dump glucose into your urine instead. This creates an osmotic effect, pulling extra water with it. That's why you might suddenly need to urinate every hour, even waking up multiple times at night when you never used to. The Mayo Clinic notes this symptom often appears first because kidneys detect high sugar before other systems show damage. What feels like a simple nuisance is your body's overflow mechanism kicking in. The more sugar in your blood, the more fluid gets flushed out. 2. Excessive thirst. The dehydration alarm. When your kidneys flush out excess sugar through frequent urination, they pull water with it, sometimes several gallons daily. This leaves your blood abnormally concentrated, triggering your hypothalamus to sound the dehydration alarm. Patients describe drinking over 2 gallons of water, yet still feeling parched, their mouths staying uncomfortably dry no matter how much they drink. Summa Health reports that this symptom is often blamed on hot weather or exercise until other warning signs emerge. The thirst isn't just noticeable, it's relentless, like your body demanding a constant water supply to function. Your brain pushes you to drink more to compensate for the fluid loss, but the cycle continues with high sugar levels. This isn't normal thirst from a hot day. It's your body pleading for help to restore balance. 3. Blurry vision, the lens distortion signal. The lenses in your eyes constantly adjust to focus light, relying on precise fluid balance to maintain clear vision. When blood sugar stays high, it pulls fluid from tissues, including your eyes, altering the lens shape unpredictably. Patients describe vision that improves when sugar levels drop, then blurs again after meals. The American Diabetes Association notes that this symptom is often mistaken for regular aging vision changes. But unlike typical presbyopia, this blurriness fluctuates throughout the day based on blood sugar levels. High glucose thickens the eye's fluid, distorting light as it passes through. Some report seeing halos around lights or struggling to focus on text. These aren't normal vision changes, they're physical distortions caused by sugar-altering eye chemistry. Left unchecked, this can progress to permanent damage. 4. Slow healing wounds, the repair system failure. White blood cells and growth factors usually work together to heal wounds quickly. But high blood sugar thickens your blood, slowing circulation to the wound site. Less oxygen and nutrients reach damaged tissue, while bacteria feed on excess glucose in the area. What should be a minor scratch becomes a month-long battle. Paper cuts refuse to close. An ingrown toenail turns into an infection. Medical News Today reports diabetics take 60% longer to heal than others, even with minor wounds. High glucose damages small blood vessels, restricting blood flow needed for repairs. It also weakens immune cells that fight infection. Minor injuries can spiral into serious infections quickly without proper healing. This isn't just bad luck with cuts, it's your circulation system struggling under sugar overload. 5. Increased appetite. The starvation paradox. Normally, insulin helps glucose enter cells for energy after eating. However, with insulin resistance, glucose builds up in the blood while cells starve. Patients report eating full meals yet feeling hungry again within 30 minutes. Your body demands more food because cells can't access the glucose already present. This creates a cycle where eating more raises blood sugar further without satisfying energy needs. The brain receives starvation signals despite high blood sugar levels. This isn't normal appetite fluctuations. Your cells send distress calls because they're surrounded by fuel they can't use. The more you eat, the worse the problem becomes as sugar levels rise. 6. Unexplained weight loss, the fuel waste alarm. When cells can't access blood glucose for energy, the body breaks down fat and muscle. This emergency process creates ketones as acidic byproducts, forcing the kidneys to work overtime, flushing out sugar and waste. Patients report losing 10 to 15 pounds unexpectedly, and clothes fit looser despite eating more food. The body essentially consumes its tissues when it can't use available glucose. Muscle mass decreases while fat stores get burned for fuel. This isn't healthy weight loss, it's your metabolism failing to convert food into energy properly. The more your body breaks down tissue, the weaker you become. 7. Tingling or numbness, the nerve distress call. Your nerves, especially the tiny vessels that feed them, need constant blood flow to stay healthy. High blood sugar damages these vessels over time, cutting off oxygen and nutrients to nerve endings. The longest nerves, running to your feet and hands, show damage first. Patients describe pins and needles sensations like limbs falling asleep unexpectedly. Others feel burning pain, especially when waking up. These sensations aren't just annoying, they're your peripheral nerves failing from sugar damage. Left unchecked, the numbness can become permanent. 8. Dry mouth, the salivary system failure. Saliva does more than moisten your mouth. It protects teeth, neutralizes acids, and fights infections. High blood sugar reduces saliva production, creating a dry environment where bacteria and fungi thrive. Patients describe needing water constantly to talk or swallow. Lips crack, the tongue sticks to teeth, and breath may smell fruity from ketones. When blood sugar stays high, salivary glands struggle. Without enough saliva, chewing and swallowing become difficult. The mouth feels sticky, and taste changes occur. This isn't normal dehydration. It's a sign that your oral ecosystem is failing. High glucose in saliva feeds harmful bacteria, increasing infection risks. 9. Gum problems. The oral health alarm. Healthy gums should fit snugly around teeth, protecting against bacteria. High sugar weakens the collagen holding gums together while feeding harmful bacteria. You might notice gums bleeding during gentle brushing or flossing. Some patients report rapid gum recession between dental visits, teeth appearing longer as gums pull back. Dentists see accelerated periodontal disease in patients with uncontrolled blood sugar. Small gum pockets deepen quickly, allowing more bacteria to accumulate. The inflammation isn't just localized, it's a systemic reaction to high glucose levels. People describe teeth as feeling loose or noticing pus around gum lines. These aren't typical gum issues. They're visible signs of sugar damage affecting your entire body. The mouth becomes a warning system for metabolic distress. 10. Fatigue, the energy crisis signal. Your cells need glucose to make ATP energy, but with insulin resistance, that glucose stays trapped in your bloodstream. Despite high sugar levels, your cells starve for fuel. Patients describe exhaustion that feels different from normal tiredness. Naps don't help, coffee stops working, and basic tasks become overwhelming. When cells can't use glucose, the body switches to less efficient energy sources like fat breakdown, creating an energy deficit at the cellular level. Simple activities leave you drained because your body struggles to produce enough ATP. The fatigue persists because the root cause, insulin resistance, remains unresolved. Conclusion: these 10 warning signs never appear alone. They work together like a home security system, triggering multiple alerts simultaneously. Are your sweats more than usual at night? Do wounds heal slower? Constant thirst? Several symptoms together signal real trouble with blood sugar control. If you notice 3 or more signs, get an A1C test now. Early action prevents most diabetes complications. Research shows that early detection allows you to avoid nerve damage, vision loss, and other serious issues. Your body sends clear distress signals when something's wrong. Learning to recognize them could change everything. The difference between catching this early and catching it late could be decades of health.
Thank you for watching our video, and if you enjoyed it, please subscribe to see more. Please leave us a thumbs up to support this channel.